Good morning, everyone. I'm Larry Boris, the Executive Director of the National Association of Worksite Health Centers. This is one of a series of monthly activities and programs that we have for our members and others to help them improve and expand what they do relating to on-site, near-site, mobile, and virtual health centers. NAWHC, for those who are not familiar, is the nation's only nonprofit organization that focuses specifically on this type of health benefit. We assist both employers, providers, and consultants and third-party vendors who manage these centers for covered populations, offering educational programs. Every month we have a first Monday roundtable networking, and then we have webinars, usually on the second Wednesday of the month. We also offer benchmarking services. We have a clearinghouse of information, the nation's only clearinghouse on worksite health centers. And we have a variety of networking and other programs. For those who want more information about our organization, you can go to our website, nawhc.org, as well as our LinkedIn group. Today's program is one of several. As you see, this is a variety of members. We have companies of all sizes and all locations from around the country, all industries. And so if you're not a member and you're interested in learning more, or you want to gain more value from your worksite center investment, please feel free to contact us. Upcoming programs, we've got next month, we'll focus on health equity and outcomes. We'll have our annual meeting in Indianapolis, August 22nd and 23rd. We'll have a session on integrating whole person health in September, obesity management in October, and then a legislative and legal update and its impact on worksite centers following the election. So with that, I'm going to turn the session over to Carrie Klinkert from Brown & Brown, who will introduce our speakers and the program for today. Following the formal presentations, if you will put questions in the chat box, we'll try to respond to that. In addition, I'll be going around the table and inviting people individually to ask questions or share experience following that. So with that, by the way, this is being recorded. The recording link and the slides are available to those who've registered for the program today. So with that, I'll turn it over to Carrie. Carrie, thank you very much.
All right. Thank you, Larry. Can I get confirmation from my friends on the call that you can see the PowerPoint screen, the cover page? All right. Thank you, Larry, for the introduction. First and foremost, we will be there in August in Indianapolis at the annual conference. So we're looking forward to seeing, hopefully, a lot of you there in Indianapolis in about a month's time. So thank you for your time and attention today. Good afternoon, good morning, wherever you may be around the country. Thank you to Larry and NAWHC for hosting us. As he said, my name's Kerry Klesick. I'm with Brown & Brown, joined the firm in 2016. I'm part of our advanced contracting strategies practice at Brown & Brown, which is a dedicated wing of our business that focuses solely on helping employers across the country with their strategy, with return on investment in what they put into a clinic and a health center, on-site, near-site, virtual, all of that. We're one of the biggest benefit brokers in the country, so we work all over the country. Our team is spread across the country, but I'm coming to you live from Milwaukee, Wisconsin. One of the centers of the political universe this week. We won't talk politics today. We'll keep it population health and clinics, okay? But great to be with you. I live in one of the costliest states in the country for healthcare. You know, our clients here in this state, and for the case for many of you across the country, have been forced to get creative and innovative, or else you die on the vine from an employer-sponsored healthcare perspective. And I certainly feel, and our team certainly feels that, you know, still to this day, and more maybe so than ever, a health center, a clinic can be a crucial and very effective tool for a sizable employer when deployed, when measured, and when done well. Not just as a benefit to the employees, not just as a place for urgent care, but truly as a place to become the center of a benefits neighborhood, as a significant opportunity to engage in advanced primary care models. And as it relates to kind of this topic today, leverage that program to help drive population health strategies and initiatives. So very excited to have Megan from our team at Brown & Brown on the call today, Abby from Ashley Furniture Industries, and Marley from Proactive MD. Maybe you three, I'll toss it over to you three. Won't read the learning objectives on the screen. I assume you folks can read. But maybe you three can kick us off by introducing yourselves, talking about your role, and then Megan, maybe further kick us off.
Yeah, absolutely. Thanks, Carrie. Good morning and good afternoon to everybody. Thank you for joining in today's conversation. I feel that it's going to be a very fruitful and beneficial conversation. So my name is Megan Myers, Population Health Consultant with Brown & Brown. In my role, I work across our book of business with our clients as a part of our advanced contracting strategies team. So work with clients who have clinics, work with clients who don't have clinics on developing and executing population health strategies. I'll go ahead and kick it over to Marley next.
Thanks, Megan. Hello, everybody. My name is Marley White. I'm the VP of Service Delivery at Proactive MD. Been here since 2000, and my job is to work directly with customers like Ashley Furniture, which I have the pleasure of working directly with Abby on their account, but I also oversee all of our accounts and the strategy that we have to work alongside of consultants to move the needle for the customers and the patients that we serve. Abby?
Thanks, Marley. My name is Abby Mestad. I am the wellness manager here at Ashley Furniture. I've been with the company just about 3 years now. Within my role, I help oversee our on-site clinics that we have, also help with all of our wellness strategies, and also oversee nutrition, food, and vending as well. So with that, I'll kick it back to Megan to start us off here.
Wonderful. All right, so broadly speaking, population health can be defined as health outcomes of a group of individuals, including the distribution of those outcomes within the group. So really, it's an approach to health that aims to improve the health of an entire human population. So how the population is viewed and managed can be seen through multiple lenses, dependent upon who the stakeholder is. We find that when there is synergy and an integrated strategy amongst the consultant, the clinic vendor, and the employer, that's where we really warrant better healthcare outcomes. So today we're going to walk you through a view from each one of our lenses and how we work together to ultimately improve population health outcomes. I'll kick us off by sharing tools and techniques we utilize to work with a client as well as their clinic vendor to help manage the population's health. Upon working with a new client or implementing a clinic when one has not existed, or even transitioning to a new clinic vendor for an existing clinic, one of the first steps we take at Brown & Brown is reviewing the elements of what a successful health center entails, which you can see outlined on the slide here. We focus on engaging in conversation with the client to understand where the clinic should be located, what type of clinic would be most beneficial based on their population, as well as defining eligibility, formulating a successful staffing model, and identifying the appropriate timing in which the clinic should open. We also ensure that there is alignment around how we are defining and measuring the ROI of the clinic, which includes the evaluation and impact that the clinic users are having on the health plan versus the non-clinic users. A key driver of engagement is to ensure that the health center is viewed as the center of the client's benefit ecosystem. In order to make this happen, we serve as the liaison and the conduit and work with the clinic to coordinate and organize vendor summits and ongoing meetings with the programs that the client has in place to ensure that the providers are fully aware of and understand the benefits that are available to the client's population. We also ensure that they're equipped with ways in which they can refer members to these solutions when appropriate. Part of this process also includes identifying how referrals will be managed and tracked. In order to measure the success and impact the clinic is having, we work with our clients to set yearly SMART goals around metrics and key performance indicators. These goals are certainly unique to each client based on what we are seeing within their specific claims data, as well as fully understanding their population's needs, demographics, locations, and so on. Some of these examples of goals that are set include evaluating clinic utilization, population health engagement and management, and referrals into the client's benefits ecosystems. In a bit, I will share a couple examples around the positive results that we have seen when goals have been set with each of our clients. To help drive member awareness and engagement, a strategy that we have found to be very effective is working with both the client and the clinic to create an annual member engagement calendar. What we do is sit down and determine a topic and health category for each month that is set for both on-site and clinic events, and they're planned and scheduled around member-facing communications that are created to help drive participation. Where we find significant value here is getting the clinic providers into the plants, into the corporate office, into all of the locations to really begin building relationships with members and possibly start to drive attention to those who may have not been aware that the clinic even exists or how to even schedule that first initial appointment. In a bit, Abby will actually share a few unique examples on how she has worked to engage her population in conjunction with the clinic. The data on this slide was part of a feasibility study that we conducted for a client who was evaluating implementing a clinic in another one of their locations. They did have a clinic already in existence in a population in which they saw the most need. While they saw success in that initial clinic, they knew they wanted to reach a broader portion of their population. As you can see indicated on the slide here, chronic members made up about $9.5 million of their annual medical and pharmacy spends. Of the 41% of chronic disease members within their population, a little over 16% were considered high risk. Additionally, 287 of those members had more than one chronic condition, which we all know costs increase dramatically for each risk factor in existence. By simply engaging even 10% of those chronic members within the health center, there was a potential for a $950,000 of the chronic costs being diverted. Here is a client example of successful goal setting and ROI evaluation in action. With this particular client in 2022, we set a goal around increasing both hypertensive and diabetics engaging in the clinic. The goal was set that by 2023, we wanted to see an uptick in around 15%. In the hypertensive bucket, the population size increased from 216 members to 351, or a 62.5% increase. In the diabetic bucket, the population size increased from around 92 to 142 members, or by 54.3%. So as you can see in both disease states, the clinic users are costing significantly less than the non-clinic users. Another critical component of managing a population's health is to ensure that the clinic is assisting members in closing gaps in care. Here is an example of where we've seen that come to fruition. While we know that there's certainly still room for improvement in some of these areas, the clinic has done an excellent job in ensuring that the clinic users are completing their annual preventative visits and their age and gender screenings compared to non-clinic users. As part of our process and evaluation of a clinic's overall ROI, we evaluate the cost of clinic users versus non-clinic users. While you may notice, and it may come across as alarming, that the current risk score for clinic users is slightly elevated compared to those of non-clinic users. However, what that is suggesting is that the clinic users on average are actually sicker than the rest of the population, which is exactly what we want to see. By the clinic having the ability to manage these members, they ultimately have a hands-on active approach in driving successful results and overall reducing cost. Additionally, this also shows the opportunity and that we need to continue strategizing on ways in which we can engage non-clinic users into the clinic. What you'll also see here is that the clinic users' risk-adjusted claims is slightly less than non-clinic users by about $1,293. In turn, this is resulting in a suggested ROI and cost avoidance of just over $2 million from clinic users. Next up, we'll turn it over to Abby to share what population health looks like from the employer lens.
Thanks, Megan. So I thought it would be helpful to start off this chat here with just a quick snapshot of who Ashley Furniture is. Many times when people hear or think of Ashley Furniture, they think of our retail side. And while that is one of our aspects of the business, we are a manufacturing company. We are the world's #1 manufacturing company of furniture. And we have approximately 120 enterprise home stores with more licensees home stores. We also have an expanding online presence like many other major retailers, and we are the #1 furniture brand in the United States. Our employee population is made up of about 15,000 people in the United States, 19,000 of those being medically enrolled. Those individuals are made up of manufacturing individuals, so the ones that are actually making the furniture, our drivers, including both our semi-truck drivers and warehouse workers, retail staff, and then office or corporate staff. As I talked about before, we do have a national presence. We have a large Spanish-speaking population. We are heavily male-dominated in our workforce. And many of our employees do not have access to email or computer access during the day due to their jobs. So as many of you know, you can go to the next slide, that communication can sometimes be hard in a manufacturing setting or even in a truck driver population setting because of that lack of email and instant messaging and internet access for large pockets of employees. So in a little bit, I'll talk about some of those common and unique approaches that we utilize here at Ashley Furniture. But right now, I'm going to bring it back to some of the goals of utilizing on-site health clinics to integrate population health within Ashley Furniture. So some of our main goals are the promotion of primary care and employee engagement. We really want to make sure that our employees are first aware of the risk of chronic conditions that they may have. And then if they are identified, we want them to receive the care that they need in order to resolve those conditions before they turn into larger and more expensive conditions. We want our employees to be engaged. We know that employees who are more engaged with their health and well-being are generally more productive, both in and off of the job. We want a care team to be focused on social determinants of health. Much of our workforce is blue collar, so it is important to have care teams that can meet our employees where they're at. We want them to understand their personal health goals and work with them through the stages of change if necessary. I'll talk more about this in a little bit on the reasons that we went with Proactive MD, but one of the main reasons is for their patient advocate position, and that position is really focused on the social determinants of health of our employees here at Ashley Furniture. We want these employees to succeed in their health goals, and sometimes they just need someone in their corner to help access the services or be more aware of the benefit offerings that we have here at Ashley. Another goal is our enhanced employee satisfaction and retention. Having on-site clinics is a major health benefit overall that we offer to our employees. Our on-site clinics have $0 copays and are available for the use of all of our employees and all dependents that are on an Ashley medical plan. So we try to make it a healthcare home for our employees and their family members. The next goal that I'll talk about is the convenience and access of it. So our on-site clinics are located on property at our facilities. Many of our clinics are in very rural areas, just being where our largest manufacturing sites are located. And many of the employees are from those very rural communities. So convenience and access goes hand in hand with that. Additionally, specifically in Mississippi, we have some smaller manufacturing plants that are located about 30 miles outside of our main manufacturing plant, which is located in Ecru, Mississippi. So in partnership with Proactive MD, we are actually starting to do 2 days a month at those at one of those outside facilities to help bring that access even closer to employees in that location. And then finally, last but certainly not least on our goal sheet here is the return on investment. So it is important to look at the productivity measures for our employees. With our population, it would be common for them to push off care due to a number of reasons, time being one of them, time off of work, the distance to the healthcare center. Again, being in rural areas, it's harder and farther to go to get that health care, and then the cost of our appointments. So with our on-site clinics, we take all of that away. We make it easier for employees to go in and get the care that they need rather than pushing it off and possibly making it worse and more expensive in some cases. As Megan mentioned, our clinic users versus non-clinic users and their chronic disease management and healthcare utilization trends are key indicators of cost savings for those that utilize our on-site clinics, along with our financial and cost avoidance data that we see as well. So this is a map just to kind of showcase our 3 on-site clinics that we have here at Ashley. So one in Arcadia, Wisconsin, that is run by a local health system. One in Ecker, Mississippi, which is run by Proactive MD. And then the third in Advance, North Carolina, which is also run by a local health system from North Carolina. These are our Ashley Furniture's 3 largest manufacturing sites. So that's what's warrants a clinic at these locations. Again, these clinics are free for our employees and their dependents on an Ashley medical plan. While each clinic offers preventive care, each specific clinic has additional dependent and employee population engagement strategies. And different services that we offer. So some of those include physical therapy, counseling, labs, specialty services, and then patient advocates, which Proactive MD offers. So next I'll talk about some of our common engagement approaches, which I'm sure all of you on the employer side of the call have some variation of communication strategies that are listed here. So we have internet articles, we have our weekly 5 videos that we put out that are, short little videos for individuals to watch. We send multiple emails, we have bright screens on our TV monitors throughout our plants and other locations. We use paper flyers, we use home mailers. We utilize Castlight, which is our benefit offering platform. They have in-app messaging and pop-up notifications that we can use for those who are registered within Castlight. And then obviously promoting all of our benefits through new employee orientation. While we do use all of these, we do have lower engagement numbers when it does come to our manufacturing populations and truck driving populations. So we try really hard to think of some out-of-the-box ideas when it comes to engagement strategies as well. So on the next slide here, we'll go over some more unique ideas that we have done in the last couple of years. So in February, it is Heart Health Month. We do free blood pressure check events. So we actually have our clinic team go into our on-site cafeterias during busy lunch breaks. And we sit in the cafeteria and just say, hey, come on over. We're doing free blood pressure checks. Why don't you come and see what your blood pressure is before you sit down and eat lunch? And so by doing that, we do that with our cardiometabolic management partner, which is Omada, and our on-site clinic. So it's the nursing staff that is actually doing those blood pressure checks. And that's a way for us to both promote Omada and our on-site clinics. If someone does have an elevated blood pressure, we'll say, hey, have you ever been up to the wellness center? Why don't you come back after work and we'll get you set up with an appointment and kind of check this out to make sure that there's nothing else going on. So just kind of an out of the box idea that we use for promoting blood pressure checks. In June, we do colon cancer awareness. So we actually have a large inflatable colon that we use, and we set it up in a grassy area kind of outside the lunchroom for people to actually walk under, and we give out free fit test vouchers. so that they can go up to the clinic and turn those in to get a FIT test for colon cancer awareness. In August, we have our Ashley Family Day picnic. So this gives us an opportunity to get in front of both employees and their family members. We know that many times the person in the household making the health and wellness decisions isn't always the employee that's here at Ashley. So we utilize that to get our wellness and benefit vendors on site and in front of the other parts of the household. In October, we do mobile mammogram events for breast cancer. We also do on-site flu shot events that our clinics put on for us. So again, just a really great way for our on-site clinics to come in front of the employees. You recognize each other's faces. Oh yeah, I've seen you in the clinic, or oh, you look like a new face. Why don't you come up and get started with a primary care visit? Just really easy ways to get involved there. And then finally, November is National Diabetes Month, so we do free blood sugar check events. They're very similar to the blood pressure check events that we do in partnership with Omada in February. So really great ways to get our clinic staff down into our plants and on the floor and meeting with individuals at all times. So with that, I'll hand it over to Marley to talk about the clinic vendor lens.
Thank you, Abby. So again, good morning, good afternoon to everybody. So I'm going to talk through what, as a health center vendor, we look at when we're being brought onto a new customer. We're fairly new in our relationship with Ashley Furniture, how we set ourselves and our customers and our broker partners up for success for great outcomes, and then what are kind of those 5 key indicators that help us know that we're doing a great job to meet top health goals. So the first 3 buckets that we hit when we're bringing on a new customer is first and foremost, what Abby already went through, is we want to understand the client's goals. So every customer has different reasons that they bring a health center on board. Some are going to be focused on the benefits side, the employee retention or attraction. And then a lot of our customers are going to be focused on the pop health, which is what we're talking about today, which as a public health person, this is where I really have a good time. And then the consequence of all of this being the ROI, which most of our customers are going to have some interest in what that ROI value is associated with these initiatives that we're going to put in place. So after we understand really what that customer's goals are, we're going to look at what's the past performance, what's worked really well for them as an employer. So Abby's a great example of an employer that's already been really creative. She knows what events work with her population. She knows what doesn't work with her population. She knows where there's areas that we might need to pay particular focus on. And so we're going to listen to her and understand what's worked really well. If they've had past clinic vendors, learning from things that work really well with those vendors or where there were opportunities. And then utilizing that claims information that partners like Brown & Brown can bring to the table to say, okay, where in the plan performance are we seeing that employees are engaging or worse yet, not engaging with the benefits that are available to them. And then after we get that historical perspective, we're really going to make sure that we understand the population profile that we're dealing with. Again, that comes a lot from Abby, from that claims experience, and then also just our previous experience with working with manufacturing groups like Ashley Furniture. Abby already mentioned that one of the best tools that we have in our toolkit as an organization is the patient advocate role. We always talk about healthcare scary for folks. I think we all know why, because we've all had those scary healthcare experiences, particularly when we go out into rural communities. There's a lot of maybe ideas around healthcare, why it's a good thing, why it can be an even scarier thing to interact with. So we can bring somebody that is just a non-clinical individual, but that understands all those things that surround health, out into their work site, out into their communities, and get to know them. Then we can draw them back into care once we've established that relationship. So we lean on that a lot in the strategies that we put together for our customers. So on the next slide, I want you to see kind of the 5 areas where we track success as a company and with our customers. We look at these on regular reporting, so monthly reporting, and also quarterly strategy sessions to make sure we're hitting the mark. So what I'm going to do is go through each of these 5 metrics of success, give you some questions that you might ask yourself as you're considering these buckets, or you have a health center vendor that you're working with and that you as a team may be considering within these buckets to be sure that you're on track with meeting your goals. So we'll go into the first section, which is population engagement. So this is really key. For us, if you're not engaging the population and engaging the right individuals within that population, you're never going to hit those goals that you're setting with your customers, and that, as in particular, we've set with Ashley Furniture. In our model, we consider engagement if they have engaged with a primary care provider. So if they come to see us for a flu shot or a blood pressure check, great. We're really happy that we've started that relationship. But until they've met with that provider and been able to do a full physical, understand health history, and start to create an action or treatment plan for those patients, we know we haven't done enough. So that is our metric for success: is has that patient engaged with one of our providers? We look at that globally to say how many employees have engaged with that provider, how many spouses, if there's dependents on the plan, how many of the children are we getting in? And then we look specifically at those high-risk groups. So of that group, of our diabetics, those with hyperlipidemia, those with hypertension, what percentage of those patients have also come in and engaged with our providers? We have the benefit when we're brought on board, like most clinic vendors, that we also have claims information integrated. So when you look at a report like this, this is showing us all of the folks in that population that have a diagnosis for diabetes, whether they've seen us or not, and then what percentage of those individuals have come into the health center. We believe firmly if you come in for advanced or direct primary care within our model, you're going to get better care. So our goal is always to bring folks in and let us be their medical home. When we're looking at engagement, this kind of gives us an idea of who we're engaging with, which is important to benchmark our success on how we're impacting the population. But it's also really, and maybe even more important at a point, to understand who we're not engaging with. So we'll flip these questions on their head and say, okay, of the people that aren't engaging with us, what does that population look like? Are they mainly male? And so we may need to do a specific technique with them. Are we seeing that we're engaging a certain age population? And so maybe we need to change our approach with how we're doing marketing, or maybe we need to go to more community events that population may be engaged with, to help start to gauge their interest and what things would matter most to them. So take into account not just who is, but who is not, and then using those factors to tailor a marketing approach, like what Abby's done already with the events that they host at Ashley Furniture, to pull those people into regular care. So let's move to the next section. So we've looked at engagement. So what percent of the population is coming to see us? And now the question is, for what? So we always want to keep a pulse to make sure, and Megan mentioned this at the top of the discussion, that we're not just serving as an acute care clinic. That has some great short-term benefits. Getting folks back to work quickly can be a good attraction and retention tool for employers. But when you're really looking for a long-term ROI in this investment in the health center, which is substantial for a lot of our customers, medical home, so primary care, is where you're going to get that bang and that impact. So we want to keep a regular pulse in our monthly reports on what are folks engaging with us for care. In our ideal model, they're engaging primarily in chronic care management, prevention. We're also serving acute needs, so we've got that availability there. But we want to make sure that we're looking at a service pie chart that's screaming to us that we're serving medical home model for these patients, and not just an acute sniffles kind of clinic. We also will use this to determine, are there any other services that we could be providing to drive engagement? So that may be things like on-site physical therapy, on-site counseling, which some of our patient advocates will do, depending on their background, more dietetics, so bringing somebody, an RD on site to provide dietetics consults. So are there services that we think would benefit patients, but that would also help drive that engagement into long-term care with us? And then, probably surprising to some folks on the call, it was for me, I made this transition in my mind just 4 years ago, I guess, when I joined Proactive, is occupational health. So we actually find when we're also pairing primary care with occupational health, it's a great driver of primary care engagement. That feels counterintuitive sometimes, because you think, well, that's more working for the employer versus the patient. Not so. What I see it as is, if we can do, or as I mentioned earlier, one of the primary reasons that folks don't come from here to healthcare is fear. It can also be time, but a lot of times it's just that fear of crossing that initial threshold, that lack of comfort in this environment. With occupational health, when you do things like pre-employment or urine drugs, you're requiring them, you're pulling them over that threshold to engage in care. And then our team's able to go ahead and start building that relationship and that rapport with them, tell them the difference in the sharing of medical records in one versus the other. And it gives us that opportunity to do that one-to-one pitch, which we know is the most effective. So we oftentimes will also use this service to identify, do we need to also add occupational health as an option to drive engagement in this group? The next section is utilization. So not only who and for what, but how much are we engaging and utilizing the calendar at the health center? So we make sure that customers, and we're benchmarking to say how many of our available appointment slots are being utilized for care with the provider. We provide heat maps so that we can see, is that time a time? Are we using those times evenly, regularly throughout the year, or do we need to make adjustments in schedule to be better available for our patients? So Abby mentioned earlier that access is a big issue and a goal for Ashley Furniture, one of the many reasons they put their health centers on site. So they're trying to remove barriers. Scheduling can be a big barrier if you don't have that right. So we use that heat map and also use a no-show rate to determine if we're setting ourselves up for success with the schedule that we have available for patient care. We also will look at utilization of both provider and nurse staff, so we can determine, do we have enough staff to meet the needs and the goals of our customers? Oftentimes, we have to set goals in small chunks, and it may be that we have enough to meet the need right now, but as our goals expand, our staffing needs to expand as well. So we keep a watch on that to make sure that we're able to meet all the needs of those patients, that the patient experience doesn't start to falter, because oftentimes what you'll see is that the health center will start to look like it's not providing the ROI, and it's just the patient experience isn't what it should be. That can be due to a multitude of reasons, but one could just be simply not enough staff to meet the need. And so we want to keep a pulse on that, and to also make sure that we're setting our team up for success so that we keep long-term providers, because that relationship is paramount in making sure that you're changing the trajectory for these patients. So making sure that the load is something that works well for the providers, and so you can keep them on board, is really important. So this is an important metric that we look at with our customers as well. And then the next one is patient feedback. So I would say that this is just as important as anything, especially talking through the patient experience side of things. We have to be listening to our patients, or in the case of an employer, to your employees, to know what is resonating, what's not resonating, especially to get to those hard to reach groups that may be out there not engaging in the care that we know that they need to better help our population health. So we do surveys at every visit with a tablet. We also have email surveys. We have QR codes that we'll push out in marketing and at events. Our patient advocate is one of the best tools that we use for this. They do something called listening posts, where they'll go on site and just be there. So be there during high traffic areas, in the break rooms or in the lunchroom. If we have the ability to walk lines, if we're in manufacturing, we'll walk the line, go to safety meetings, and just be there for that formal and informal feedback from patients about why they are not engaging in care. And it's really critical to make sure that that experience stays consistent and stays excellent, or you won't get the patients in the door, and you're not going to have outcomes if you don't have the patients in the door. So utilizing this feedback direct from the patients is really important, as well as regular touch points with our customer. So their boots on the ground. Abby and her team are awesome, and they bring us feedback, good, bad, and the ugly, so that we can address that really quickly and stay ahead of any issues that might be coming up related to perception around the health center. And then last but not least, Abby ended on this goal too, so return on investment. So we look at return on investment through two different lenses, I'd say, for our customers. So I've mentioned some kind of informal things that customers will bring on a health center for. But when you think about population health and how you're impacting that group, ROI is a consequence of good care, which is great. We always tell our clinicians, if you provide great quality care, where patients feel cared about and you're meeting those quality metrics, the cool thing is they cost less. Which on a population level, one patient at a time, you start to change your plan experience as well. So we look at that through two lenses. One is service savings. So are we providing value through the services that we're offering? So we attach values related to the services we're offering, associate the savings from better management of care for our chronic care management patients, and then removing our plan costs, we're able to estimate an ROI from having the health center on site versus using community providers. So that's one way we look at it. Another way that we also track regularly for our customers is looking at PMPM. So again, we always say that the proof is in the pudding or in the PMPM. If we're doing a really good job with that person-to-person care, again, that pop health, you're going to feel an impact there. So you'll feel an impact in your claims. So we'll look at that. What's the projected claim spend prior to us coming on board versus when we come on board, and are we making an impact? This will oftentimes also steer and adjust our goals if we see areas where we need to pay potential focus. Maybe there's more utilization of urgent care ERs than we would have anticipated. Well, we'll do a more targeted marketing approach for those patients or to the population as a whole through lunch and learns, on-site listening posts to help start to refocus and re-educate that patient population about how to use that care model. All right, and so the last two slides just kind of hopefully pull together the three different strategies that we've talked about, or the lenses that we've talked about specific to Ashley, and then we'll talk through the three objectives really briefly and kind of pull it all together in the last slide. So learning from the past, so with Ashley, as I mentioned, we knew Abby knows her population really, really well, so we're able to identify quickly. Giveaways work really well with this group. Being on site during shift hours is paramount, and there's some events that have worked really well in the past that we can tag team on and start to build on for this year. The Brown & Brown team was able to bring us the previous claims data and help us understand that there was low general engagement of the health center in Mississippi, specifically around preventive care services. Patients were not engaging with those at the levels that we really need them to see a big pop health impact. And the two most high-risk cost drivers we needed to focus on are diabetes and hypertension. Our team was able to bring on-site engagement plans, the patient advocate model, previous experience with manufacturers and these male-dominant industries, and how we will approach bringing those patients in, as well as just the clinical model that we have set up that would drive engagement. And then moving forward on the next slide, what our plan of attack is for right now as we start our relationship is, again, making sure that the client is bringing us that patient satisfaction feedback, that they're engaged in helping support us in our efforts to go on site and engage with patients. That's really critical. We can only do so much from the health center if we can't go on site. So Abby and her team have been spectacular about helping us get on site, get pieces out to their team members, and then also helping with monitoring turnover and absentee rates as we go. So we also see indirectly, as we have really strong health center and population health programs, that also impacts turnover and absentee rates for the customers we serve. Brown & Brown team keeping us on track with plan performance, making sure that the plan is set up in a way that decreases barriers to care and improves outcomes for those patients. So things like copays, prior authorization processes, other on-site services like physical therapy, and then shared in that communication or engagement plan that Megan talked about at the top of the talk, so that we're bringing all those things together and that we feel like a team that's pushing things out and that patients aren't being hit by things that don't feel coordinated. And then last but not least, the health center team, we're focusing on that targeted outreach through our patient advocate team members on site, and then also via telephone, text, email, doing regular on-site events, as Abby mentioned, going to some of those other smaller manufacturing sites there in Mississippi so that we remove that access issue or that travel issue that might keep people from coming to see us. We're going to go to them. And then being consistent with reporting out our KPIs and our goals to Ashley, which are the 5 things that I just talked through, and then making adjustments as we go. So finally, last but not least, is bringing the pieces together. So my teammates will come back on camera. We're all going to go through these. First, we have to understand our population. That was one of the key metrics for today. I hope that we gave you some examples that help you see how each of us understand a population. I think one of the key things in this model that's really beautiful that you don't have as a community provider is we have the benefit of the claims data and consultants like Brown & Brown that can help shine a different light on how that population is using or not using the claims information or the benefits plan. And then it's really critical to goal set. As a health promotion person, I don't want to harp on it too much, but if you don't have a goal, you're never going to get there, right? And so making sure that you're being really overt with what those goals are. I see a lot of customers that know they have an issue. They throw a lot of things at that issue to try to solve it, but there's not really a concrete goal that they can track progress and know if they're making a difference. And I think in this team with Abby and Megan, they've already been used to setting really firm goals, and we're now jumping on and doing that with them. And then as a team, we're going to track to those and make sure that we're achieving those goals. So I would encourage everybody on the call to just make sure that you're taking some time to set some really firm goals for yourself and then tracking that progress with action steps so you can adjust and then also celebrate as you make success in your population.
Yeah, I'll talk a little bit about how to identify the ways to improve those health outcomes. So by understanding our population and the common struggles that we have in communication overall with our benefit offerings, it is important to host those events that get people engaged and remind them about the different things that are available to them that they might not think about every day. We want to be able to utilize that patient advocate position that Marley and the proactive team have, and positions similar to it to leverage our great benefits that we offer here at Ashley. We know that many times people don't pay attention to benefits until they need them. So it is important to have kind of those unique and out of the box events and specialty promotions as constant reminders throughout the year to help people keep it at the top of the mind. So we do that both with our clinics and leveraging our other benefits that we offer here at Ashley year round.
Yeah, and then lastly, I think, the third component of this is really ensuring that a strategic plan is created to drive ROI. So that has to be customized very uniquely to the client specifically and to their population. So setting specific metrics, KPIs, as Marley mentioned earlier, and ensuring that there's evaluation around those metrics is going to be a critical component as well. Also communication on progress of those goals. So where we find success is when the three of us are having consistent conversation and communication around where we're at in regards to those goals that have been set, and then making adjustments in real time as needed and as necessary to really ensure that we're enhancing patient care and we're helping manage risk.
All right, that's the end of our formal presentation. We left, man, that was perfect, right at 12:50. So I think we carved out 10 minutes. So Larry, whether it's questions on your end or questions in the chat, we've got a little time here to dive in.
Great, thank you all very much. It was great. So I'm going to go around the table, just call names out based on how you're showing up on my screen. If you have a question or comment, please do so, and we'll go through it. So let's start with Brandon Pfefferkorn. Brandon, comments or questions? And I will unmute you. No, Brandon? No, okay. Alex Gludemans from ThedaCare.
Yeah, regarding the Ashley Furniture piece, maybe just a point of clarification. Did she say that it was just for employees on the health plan and beneficiaries, or all employees?
Yep, so
No.
it's all employees and then all dependents on an Ashley medical plan.
Okay. Thank you.
Thank you. Tony Musi, Tony, comments or questions?
Yeah, great presentation. I really enjoyed the all three components of this effort coming together and sharing their thoughts. With the population of employees, you mentioned that they're not, a lot of the employees at Ashley are not connected by email and other means. And you mentioned a number of different strategies you use to reach out to people. what have you found most effective? How do you keep those employees engaged that really aren't technologically connected all the time?
That is a tough question. I think just constant communication across all of our platforms is really what I don't think there's one great way to communicate to all of our employees because they are all so different. I really wish there was, and if anyone has an idea, please shoot it my way because I'm happy to use it. But I do really think that our on-site events really stir up a lot of engagement with our employees, especially with our most recent colon event with our blow up colon. It got a lot of people talking. People were coming out and were like, "Oh, I thought you guys had a bounce house up here," because it's literally you walk through it. And we got a lot of great engagement out of that program and out of that event. And so I think just using really different ways consistently and year round is really what the special sauce is.
Thank you.
Great, thanks very much. Sonia Nolan, Sonia, comments or questions? Sonia? No? Okay. Betsy Nolan, Kirby, Betsy, comments or questions?
Oh, I just have a question about the data that Brown & Brown was providing. Is that data that's direct from the carrier through carrier reports, or do you have a centralized data warehouse platform that you have the data integrated into?
Yeah, great question, Betsy. So we actually have our proprietary data analytics software that we ingest all of the client's claims data in conjunction with the clinic data. So we're able to report out and specifically drill down on different aspects of clinic users versus non-clinic users.
Great, thank you.
Gwen Davis from Beacon. Gwen, comments or questions?
Hi. First, yes, this was very informative. I had a question for Ashley Furniture for you in regards to you have several or a few different vendors in regards to who is helping you out, and do you find any benefits in working with local healthcare system as opposed to a different vendor, or are they about the same in benefits wise for you?
Yeah, I'll be very transparent here and say that we actually really enjoy working with our local health systems because we are so rural. We have great relationships with those health systems in those rural communities in Wisconsin and in North Carolina. When we actually went out to RFP, we did contact some local health systems, and just being very transparent, the healthcare systems in Mississippi just didn't provide the quality of care that we were looking for that we see in Wisconsin and North Carolina. And so that's kind of what opened our minds to, look for a more national clinic, more like Proactive MD.
Great, thank you.
Yeah.
Thanks very much. Betsy from Wintermannon. Betsy, comments or questions?
No, thank you though.
Okay. Corey Bird, Corey, comments or questions?
No questions for me today. Thanks.
Thank you. Ed McNamara, Ed, comments or questions?
Nope, none here. Thank you.
Elaine Kwan, Elaine, comments or questions? Elaine?
No one's
Okay.
gonna ask a question to Abby about how she sourced the blow up colon. I mean, that's probably something we should answer at some point. Just saying. Okay, sorry.
No, I can answer that. That was actually from our local health system here in Wisconsin. They call it the rolling colon, traveling colon.
Okay. Again, Elaine Kwan. Elaine, comments or questions?
No, none from me. Thank you.
All right. Gary Thorpe, comments or questions?
Yeah, thanks for the presentation. With Abby, maybe a quick question. We're looking 3 to 5 year strategy. What year are you guys in roughly with using this approach? And then did you go all in right away, or just some guidance for all of us considering this option?
Yeah, so our first on-site clinic here in Wisconsin opened, is it 10 years, I think, Megan? You can correct me if I'm wrong. That was
Yeah.
a little bit before my time. Our one in Mississippi with our previous vendor, we've had it for 8 years now. And then our one in North Carolina has been live for about 2.5 years. So we started in Wisconsin, then moved to Mississippi, and then to North Carolina gradually. Does that help answer your question?
Yeah, thank you.
Howie Gerber, Howie, comments or questions?
I did see Howie had one in the chat here for me, so I'll go ahead and answer that live. His question was, please describe your approach to helping employee and family members with mental and behavioral health conditions. So I kind of touch on this a little bit, but I can dive into it a little bit more. At our clinic here in Wisconsin, we do have a counselor that sits on staff. We saw that as a need here in Wisconsin prior to COVID. So we do have that, and I would love to build that into the rest of our clinics. We just need to have the right population need for it. As far as outside of that, we have our extensive EAP program that all of our clinic and providers are aware of and promote within the clinics. And then with our patient advocate position with Proactive MD, while they aren't a counselor by means, they really are there to connect individuals to the social determinant of health needs that they may have, including mental and behavioral health out in the community. So that's a big driver to that as well. So I hope that helps answer your question.
Great, thank you.
I'll just lean in to this question as well. And what I referenced earlier too, in the importance of the clinic really being the center of the benefits ecosystem, is to ensure that the providers are fully aware of all of the benefits and resources that the Ashley Furniture team has. So that's why we work really closely to do vendor summits, to do training sessions, so that they know how to refer members at the appropriate time and where to send them, so they're not finding themselves bouncing around the system, and they have that access to the appropriate care in a timely manner.
Thank you.
Great.
Tracy O'Neill. Tracy, comments or questions?
The only thing I was curious is the slides have a lot of good information. Will those be available for reference in the future?
Yes, the recording and slides will be available, particularly for any WHC members, but those on the who registered for today as well.
Great, thank you.
Jen Manusco. Jennifer, comments or questions?
Hi, thank you very much. I appreciated all of the presentations. In particular, coming from AAAHC, I appreciated the Proactive MD perspective and Ms. White's input. So thank you very much.
Thank you. I've got some people who are on the phone. I don't have names. So someone who was 920 area code 524 6449. Any comments or questions? Okay. There are a couple people more. I'm going to touch base. Jim Mueller. Jim, comments or questions?
No, thanks for the presentation. Yeah, I work with Carrie and Megan at the Brown & Brown team. So, but thanks for the presentation. This was very informative. Thank you.
Okay, and there was a question posed earlier. I don't know if Abby or Carrie or Megan want to respond. What's your threshold for opening an on-site center? Number of employees.
Yeah, I think we can all maybe take a stab. We probably all have a different lens and outlook on this, but I think it depends. And I know that's not a probably formal answer that you'd want, but it truly does depend. And a part of, Brown & Brown, what we do is clinic feasibility studies. So if there is a client or prospect interested in possibly looking at a health center, will look at claims data and provide an analysis and a projected potential ROI that could be realized from an on-site clinic. So very transparent upfront, and it kind of just really depends, you know, situation by situation.
And Megan,
certainly, oh, go ahead, Marley.
No, I was going to say the exact same thing and say, you know, I think, and I think it was Howie's question earlier too about the transition. Health centers can start small and grow. So Abby and her team have full-time health centers. They have multiple locations. Oftentimes we find customers that, to Megan's point, either their broker consultant does a feasibility study, or we do that as well, and want to start small. So maybe even a couple of days a week and then build up, or start with a smaller care model and then build out with more support systems. So it does depend on the size, but it's more about the issues that you're seeing and kind of your goals too. We've done a feasibility where it didn't show a ROI standpoint, just looking at claims, but the customer really needed the attraction and retention component. And so they decided to go ahead and do that health center, and it has paid out for them in the end. So.
Yeah, I know we're at time here, but just quickly, I would say it depends on what you intend your ROI to be and how you want to measure it, right? And that doesn't always have to be financially. I commonly hear kind of just throwing around 500 to 1,000 lives. That said, we do feasibility studies. I would say if you're interested in sizing up your own organization, partner with your broker and ask them to do a feasibility study. We do that all the time. We've done feasibility studies for groups that are several hundred lives. And again, it doesn't always show an ROI, but we can do that study using the data, and I would encourage you to do that. But I would personally say that employers down below the threshold I mentioned are more and more looking to explore this. And it doesn't have to be, we set up our own on-site clinic. In markets around the country, in various states, we've got a few employers who one's an anchor and the others share in that, and the others are obviously smaller. So there's a way to do it. So again, it depends, but just trying to provide some more flavor there.
Hey, Ashley, you want to comment? Or Abby, I'm sorry.
I was just going to say, with us having such rural locations as well, that also plays a huge part in where you're located. You know, for us here in Arcadia, it's about 30 to 40 minutes to the nearest local health system. So having an on-site clinic is a huge, you know, benefit for our employees.
Okay, we're going to wrap up shortly. I've got 3 questions very quickly. Somebody had posed the issue of submitting $0 claims to your health plan for services at the center, so you have an idea of what your total spend is. Is that always feasible, and is that the approach you take, Abby and others?
That's what we do that at many of our health centers. Just as a health center vendor, we submit so that it's not that black box. So we'll submit $0 claims, or also we do file feeds to consultants so that they can input that directly into their system as well.
Yeah, and I'll echo what Marley said too. That's how we support our clients too, in working with the clinic vendor, working with the health system, the TPA, and getting all of that set up kind of on the back end. So certainly, you know, I'd be lying if I said at times we don't run into challenges with particular vendors or systems, but we tend to find a way to work through all of it.
Great. Okay. Well, on behalf of all the people who participated in NAWHC, I want to thank Marley and Abby and Megan and Carrie for giving us their time and expertise today. For those who are interested, again, there's more programs every month at NAWHC. I hope you'll participate, as well as at our annual program, August 22nd, 23rd in Indianapolis. So for NAWC and everyone here at Brown & Brown, thank you very much. Everybody stay cool and have a great and safe day. Bye-bye.
Thank you.